Welcome to the National Organization for Rare Disorders monthly webinar for our member organizations. My name is Will Whitman, and I am NORD's Senior Program Manager in the membership team. I'm your facilitator for this meeting, and I'd like to welcome our audience. Today, in addition to our usual member organizations participating in the webinar, we also have invited all of our member leaders to attend. So I know we have some new people on the line, and welcome to you all. I'd like to thank everyone for joining us today. All lines are muted except for the speakers. This call is being recorded and will be made available shortly after the webinar with a link distributed in our e-newsletter. NORD's monthly webinars are a benefit for our member organizations that provide rare disease community leaders like you with information, capacity building, networking, and direct access to resources. During this time of uncertainty related to the coronavirus and the evolving public health and economic impacts of COVID-19, patients in your rare disease community are looking for information from trusted sources, and your organization is uniquely positioned to provide them answers to their pressing questions. On today's webinar, you will learn how your organization can engage with your medical advisory board and medical contacts to successfully deliver critical information to your rare disease community. And just to be clear, our speakers today will not be providing answers to specific medical questions. Our speakers will be providing ideas and information for the benefit of our member organization leaders. Anyone with specific medical questions related to COVID-19 should consult their doctor and seek out the latest health updates from trusted sources like the CDC at www.coronavirus.gov. That website offers information on how to prepare and protect yourself and what to do if you think you are sick. NORD's membership team is working for you. NORD's mission is your mission. During this call, an issue raised or topic discussed may prompt you to think of a question that does not get specifically addressed within the hour. NORD's membership team is always available to help answer this and any of your questions after the event is concluded. I encourage you to reach out to us with any questions after the call by emailing membership@rarediseases.org. During our call, we will follow the agenda you see on the screen now. We will have some brief national announcements from NORD that is news to use for you, the leaders of rare disease nonprofit organizations. These announcements will be followed by our speakers' presentations and then Q&A. We will collect questions throughout the call, and our presenters will respond to them during our Q&A time. So how do you ask a question? If you are watching slides now and using the Global Meet browser, there is a chat function. To use it, type your question into the Ask a Question box on the left-hand side of your window. You can ask a question at any time during the presentation, but please note that we will address them at the end, as some of the questions will be answered during the course of our speaker's talk. For those of you on the phone who are not accessing the web features and not viewing the slides, you will not be able to ask a question through the chat function. So if you'd like to ask a question, please email membership@rarediseases.org, and we will add your question to the queue collected throughout the webinar. This is NORD's mission. NORD, an independent nonprofit, is leading the fight to improve the lives of rare disease patients and families. We do this by supporting patients and organizations, accelerating research, providing education, disseminating information, and driving public policy. Leaders of our over 300 member organizations are entitled to all the resources that NORD provides, including state-level advocacy, federal policy, communications, public awareness, education initiatives, patient assistance programs, natural history registries, research, C&E, and more. Our mission is your mission. We are all NORD, and NORD cannot exist without our member organizations. We operate to serve the needs of our collective membership. And now for a few announcements. NORD is committed to continuing to serve the members of our community, especially now in this time of need. And we'd like to welcome our newest member organizations, including Plan for Rare Foundation, the Sam Day Foundation, and the Yellow Brick Road Project. Welcome to the NORD family, new members. For more than 35 years, since our inception in 1983, NORD has focused on improving the health and well-being of people impacted by rare diseases. Now, as the world is confronted by the COVID-19 pandemic, NORD is responding to the evolving needs of the rare community. If you are looking for relevant COVID-19 resources to support your community, we invite you to review our new COVID-19 Resource Center located at www.rarediseases.org/COVID-19, which you can see on the slide here. This webpage is updated regularly with NORD-specific resources such as upcoming webinars, on-demand videos, and our policy statements. For our member organizations, we continue to curate a list of COVID-19 resources for nonprofit leaders. Last week, we featured an incredibly helpful guide from BoardSource on how to host virtual meetings. If you do not receive our membership e-newsletter, but you would like to, email membership@rarediseases.org to be added to our distribution list. The lines of communication are open for rare nonprofit leaders to contact NORD for support. Email us if you have coronavirus challenges and concerns, and we'll do our best to support your work regardless of membership status. We also encourage you to join NORD for the ongoing benefits that we continue to provide outside of the triaging situation we find ourselves in with COVID-19. This includes resources and benefits we will mention here during these updates. Are you hosting virtual events for your community during COVID-19? Or do you plan to create a resource to support your patient community following this webinar? NORD provides free promotion for our member organizations of their activities, including their resources, news, events, and more. We would love to promote your work to our 30,000 Twitter followers, 30,000 e-newsletter readers, and on our website, which receives over 1.3 million unique visitors a month. Don't forget to share the incredible work that you're doing so we can raise awareness for your cause. Also, we want to share your stories of courage, strength, and hope during the COVID-19 pandemic through a special edition of our Head of the Herd Leader Spotlight. The Head of the Herd profile series spotlights a different leader from the NORD member community every few weeks on our blog at rarediseases.org and on our social media platforms. We already know what incredible work our patient advocacy leaders are doing, but the Head of the Herd will allow the more than 1.3 million unique visitors to NORD's website each month and over 100,000 followers across all NORD social media channels to learn more about you and your cause. If you'd like to be featured in our special edition of Head of the Herd, check out last week's member e-newsletter for a link to the application. And now for our presentations. We know our members are working tirelessly to support their communities during this global crisis as rare disease organizations have felt the impact of the coronavirus pandemic on all elements of their work. Nonprofit organizations are managing this crisis by working around the clock to maintain continuity of vital patient services, but many are receiving an influx of questions from their patient community and have no guidance on how to respond. As guidelines around the COVID-19 pandemic are changing from week to week, patient advocacy organizations should be ready to engage their medical advisors and know the various ways in which they can address their community's questions and offer support. So thank you for patiently awaiting our guest speakers. First, we welcome Katie Kowalski, NORD's Senior Manager of Education Programs, to provide best practices into how to engage medical professionals to organize a webinar. Thank you for joining us today, Katie. Please go ahead.
Great. Thank you, Will, and good afternoon, everyone. So I work in NORD's education department, where our role is to provide education on rare diseases for patients and caregivers and also for medical professionals. I'll be really brief today, but back in March, our department quickly put together a webinar on COVID-19 that was targeted specifically to the rare community. We had about 2 weeks from the day we decided to do this to the day we delivered the live webinar to a large audience, and my colleagues asked me to participate today and share that process with you. So next slide. So first, I'll just mention NORD does have a scientific medical advisory committee, but their function is really to provide scientific and medical consultations to our board of directors and to review and edit medical and scientific papers that are published on behalf of NORD. And since our day-to-day job is to produce timely, relevant, high-quality education around rare diseases, our team recognized the need to create our own advisory group. So we established the education committee. I've listed their primary functions, but they basically recommend programs, partners, speakers, presenters, provide expertise and input on best practices. And we also realized that it's critical to have committees that are comprised of individuals who are going to give you various perspectives. So we try to maintain a constituency of stakeholders from different segments of the rare community. So we have medical people, patient advocacy people, social sciences people, and also representatives from the community at large. Next slide. So when COVID-19 hit, we needed to mobilize really quickly. This was the perfect time to leverage our committee. I actually called the chairman of our education committee to share our webinar idea and ask for assistance. We wanted a rare disease expert, and in this case, we got really lucky just because we were well positioned, and our education chair works day-to-day with Dr. Marshall Summer, the head of the Rare Disease Institute. And so he agreed quickly to come on board and be present for the rare community and be a speaker. At the same time, I had kind of a mission impossible, which was to identify an infectious disease speaker and a mental health expert at a time when these doctors were incredibly busy in their clinics. So we mobilized some of our less traveled channels. We reached out to the Speaker Bureau at CDC. We reached out to the Office of Rare Disease Research at NIH. And I just started calling all of my colleagues to tap their networks. And to their credit, I want to say both CDC and NIH did identify speakers for us, but it was too late for the webinar. And ultimately, the chairman of our education committee mobilized and helped us behind the scenes to find a highly seasoned, qualified infectious disease specialist. And then a colleague of mine at NORD, actually Debbie Drell from membership, recommended an incredible psychologist who agreed to come on board and cover the mental health angle. Next slide. So that's just a really quick story how we got this incredible group of panelists together quickly. They did an amazing job. We had almost 2,400 registrations and about 1,200 participants at the live event. Our work is continuing just as the COVID-19 pandemic continues, so we're producing more webinars, information guides, video vignettes, and other resources. And so my take-home message to you is that COVID presents an environment where you really need to tap all your networks, be creative, look to both internal and external sources to find the expertise that you need to provide accurate and reliable information for your communities. Next slide. In closing, I wanted to share this NORD's COVID-19 resource page. I saw Will already gave you that link at the beginning. So just so you know, we're going to be updating regularly to share events, educational resources, advocacy updates, and other information. So thank you for inviting me today, and I'll turn it back over to Will.
Great. Thank you very much, Katie. Now I'm pleased to introduce Kristen Smedley, the CEO of Curing Retinal Blindness Foundation. Kristen will share how her foundation informed and connected her community via social media and virtual meetings at the start of this crisis. Thank you for being with us today, Kristen.
Hey, thanks so much for having me. Thanks to everybody tuning in to make our organizations all even greater. What an unprecedented time, huh? So I'll jump right in. If you want to go right into the next slide, our objective here is to do pretty much what we always do with our community, to keep them informed, connected, optimistic, and moving forward. And one of the ways that we I've never been so happy, if there is some bright sides to all of this, is that especially with the rare disease community and NORD and all the resources we've all shared all these years I've been involved, being savvy at social media really came in handy, and having an active presence on social media platforms. This slide shows you that we did two big things in the very first week or so after we all kind of caught our breath, made sure our families were safe and healthy in our own homes, and then started our outreach. First of all, pay no mind to the hairdos that you're going to see with me on these screens, because if we could just get the hairdressers to be able to open up, wouldn't that be great? We did two things. In our mission, yes, we are funding research, and you'll see a really fantastic announcement coming up on one of my final slides. But one of our biggest things that we started years ago was also to support our community in terms of resources for raising blind children. And on the left of the slide, you see we did Facebook Live right away because it was easy, it's free, you all know that. One was I had someone actually from outside the CRB1 LCA-RP community, but in the greater blind community, there was a teenager that I know very well in the state of New Jersey, and she was doing a huge advocacy campaign to stop the changes in a law to IDEA that they were trying to push through in the beginning of all this for accessibility to online learning. And she's incredible. She's an incredible advocate. very well spoken, and we did a quick 30-minute interview on Facebook Live that went through the blind and visually impaired community to some heads of state departments of education, and we had some really good response for that. But it was also to inform our families that, you know, they had to start really mobilizing to make sure that our kids were going to be able to access all the online learning. So that was a huge piece. The other thing I did was simply turn that camera on and get on Facebook Live in our community page and check in on everybody, let folks know that we were doing everything we could to support, to answer questions, the advocacy that we were doing, and honestly, to check in and let them know that we were still moving forward and that we would be there for them, and we had some resources coming up. If you want to go into the next slide, the biggest thing was keeping the folks connected, because we had just decided that this year we were launching the first ever meetups for the CRB1 community in the United States, and then branching out to Spain, Puerto Rico, and a couple of other countries. And we were doing a huge kickoff at the NORD thing that was going to happen in Cleveland, and of course that all got shut down. But we didn't want to stop the momentum of families really wanting to finally get face-to-face connected. So, you know, I have on the left side of the screen Constant Contact and Zoom. It was like, what do we already have in place that we can use? Well, of course, the whole world is using Zoom now, but not many people had known about it at the time. Sent the email blast out, set up a Zoom meeting, got in touch with our scientific advisors. I mean, the first person we called was our genetics counselor, who was going to be at our in-person meeting at the meetup, at the NORD meeting, and she immediately said, I'm in. She got on the Zoom call. We spent about an hour and a half that night being able to ask questions of her, updating on what the foundation is up to, and then really just sitting back and letting the families ask their questions and chat and see what kinds of needs they had. You know, like I said, I'm always looking for the bright side. So what this has, it really deflated things in terms of being able to, this whole virus and wherever we're going, the country is moving to next, deflated us in terms of being able to meet face-to-face. However, we are now instituting a monthly, and we may even go more frequently than that, Zoom or whatever platform we're going to adopt, these online face-to-face meetups where we can have, sometimes it's just going to be conversation between the families so that they know they're not alone. Other times we are going to have our scientific advisors, you know, throughout the year, one come on each time to talk about a different facet of the disease. Educators, you know, teachers of the visually impaired. It really opened our eyes, pardon the pun, to being able to serve our community in ways that are inexpensive. You know, we are saving a lot of money and keeping them connected. So I encourage everybody to look at the online platforms that you can use to do that kind of thing. And then let's go to the next slide. So interestingly enough, in the midst, I think this is how my whole journey has been. In the very, very lows comes a very, very high, and vice versa on our journey. And our team out in the Netherlands that has been plugging along for 9 years, 10 years actually, was able to reach out to me in the second week of this whole global shutdown to say, guess what? Everything that we've been working on for all these years finally aligned, and we're able to open our first ever clinical trial for CRB1 RP in 2023. So I was able to then share that news and keep everybody optimistic. And that's a big one, as you all know, in your communities. How do you keep the optimism and spirits up and all that? And it just so happened that we were able to announce that, which has re-engaged everybody. You know, we had already done the Facebook Live first to just check in. Second, getting everybody on a Zoom, well, everybody, you know, as many families as we could on a Zoom to be face-to-face. Then we are able to drop this news and keep families connected. And if you can move to our next slide, connected and moving forward. These are the next steps. So yes, it's very uncertain right now how we're going to move forward with our agenda, but we are, like I said, going to do the monthly Zoom meetings with the families and specialists. All of our, like probably all of you, all of the massive in-person fundraisers have been shut down. And again, we had just launched a united one event in multiple cities So now we're shifting gears and trying to figure out how to put all of that online, because 2020 we're probably not going to be able to be in person, and we can't lose all of that, hundreds of thousands of dollars. I've never been so grateful that we have lots of collaborations, effective collaborations with other rare eye disease organizations, and we're coming together now to say, how can we stay serving, all of the blind and visually impaired community together and put our resources together. So we'll be, there's the social distance and quarantine is a tricky one for the blind and visually impaired community. We're addressing that. Accessible online education, we still have a lot of work to do there. And then there's a whole issue with access for the blind and visually impaired to COVID-19 testing that we're still investigating on how we're going to move forward with that. It's probably one of my biggest headaches did we ever see any of this coming? Those are the things. So keeping them informed, connected, optimistic, and moving forward.
Great, Kristen. Thank you very much. Very informative, a lot of good ideas for folks out there. Next, I'm pleased to welcome Josephine Grima, the Chief Science Officer of the Marfan Foundation. Josephine will share tips on how to rapidly respond to an evolving health crisis through efficient engagement of your medical advisors. Thank you for joining us today, Josephine.
Thank you very much to NORD for allowing us to present our experience to this response. First, a little bit about the conditions that we offer assistance to. We provide education support and research for several genetic, aortic, and vascular conditions that all have something similar in that they have life-threatening emergency complications of arterial dissection, usually involving the aorta, but in some cases arteries throughout the body. And since it's connective tissue disorder, many other body systems are affected, so the lungs, the eyes, the bones, and as all the members in the NORD community, our patients are always confronted with dealing with this rare, chronic, and long life progressive disorder. And the fear of the COVID pandemic on top of it added a lot of more anxiety. So we really just wanted to help provide as much information as possible to help with this. So can I have the next slide? So this shows our timeline of information that we provided through the pandemic. And as you can see, we reached out to our community very often with different modes of communication and a variety of different information. Some was provided by email, some was provided by social media as we posted things on our website. Other information was provided via webinars. We also just added a town hall webinar to this list, and we also provided a COVID-19 Mythbuster statement since there was so much false information that was being found on the internet as well. And then we arranged all this information on our website. So can I have the next slide? So what informed our content and how did we go about that? So, very early on March 6th, we sent out a news alert that we were actively investigating medical information for our community, reminded everybody to stay safe. We echoed the CDC guidelines that were presented at the time, and we wanted to remind patients of some adverse effects of some colds and cough medications that cause high blood pressure increase, and that's a problem for our population. And so in case they would come down with the virus, we wanted them to be safe. We also reminded them of, adverse effects of some antibiotic classes that can actually increase a person's chance of arterial dissections. So we just wanted to make sure that if our patients are coming down with the virus, that they had the proper information to help keep them safe and hopeful for a quick turnaround. While we were doing this, we also had alerted our medical advisors, and we prepared the statement internally, and that helps a lot from your medical advisors, because then we can just send it out, ask for comments, and you can get a quick turnaround and send it out to your community. So can I have the next slide? So after that first initial statement, we worked with our medical advisors really to define what was not out there for our community, and that was who is at high risk in our community. You know, the CDC just said cardiovascular disease indications, lung disease indications. Well, what does that really mean? Is it just the general arterial sclerosis type of cardiac disease, or is our population specifically affected? And so we went through this with our medical advisors and developed a medical statement so that we could assure that our community, there wasn't like a high risk probability for all of our community, but only certain patients that really had specific other cardiac issues or pulmonary issues. And we listed that out on a medical statement. We also outlined general protective strategies, because for people that did have specific lung issues, you know, maybe they could get the pneumonia vaccine, which would help protect them should they get the virus. And then also, again, reminded them all about the CDC guidelines, the cold medications, and antibiotics. We sort of put this together, had our advisors review it, and put it out on our website. And from this, as we were preparing this, we let our advisors know that we were going to do a webinar on this. So can I have the next slide? So for the first webinar, we included 3 physicians, a pulmonologist, an adult and pediatric cardiologist to really go over many of the general information that we had on the website and on this medical statement. And it was more of an interview process type of webinar where we asked questions of the physicians and we prepared the PowerPoint for them, and they could just talk through and add clarity and definition to many of those statements. And what we did was we, as everybody is using, we did Zoom, and we required registration for our participants. We also allowed them to ask questions beforehand. So we incorporated and managed all of those questions that came in into specific topics, so we can ask the physicians about those questions during the webinar. We prepared the slides for the advisors so that they wouldn't have to spend time doing that. And we, again, use this interview style to prompt the advisors to answer the questions. Can I have the next slide? So in our second webinar, from the first webinar, actually, because of the questions that came in, we realized that we could refine our medical statement and actually put on more information about personal cardiac issues that were coming up from our patients. So in the second webinar, we had already updated our medical information, and then we really tried to drill down on some of the personal situations that people were asking about, whether they would be at high risk or not. We use our statement again, and we use the guide from the patient's questions to really guide this webinar. So can I have the next slide, please? So just some tips and best practices for engaging your medical advisors. You know, explain what you need and why you need it. Even if they're busy, they're very willing to make the time to help you and turn around things in a quickly if that's what you need. and try to reduce the burden on them as much as possible. Do the research ahead of time, prepare draft statements, and help them do their job to the best of their ability. We try to engage them often and regularly, and basically we have one or two people from the foundation always reach out to them. It's myself, the Chief Science Officer, or our nurse on staff who is consistently reaching out to them and asking questions when we get questions from patients that we do not know the answers to. And we always try to anticipate important news. So we ask for information about publications ahead of time so that we can prepare our statements ahead of time. If there's like a FDA drug approval, we'll prepare statements for both approval and denial just so that we have them already set to go once a statement is released. Same thing for like clinical trial results or drug indications. And this is how we keep them engaged and keep the communication open and going forward. So thanks very much, everybody.
Okay, thank you very much, Josephine. A lot of great tips for our member leaders out there. Now I'd like to welcome our final speaker, Elise Gellerman. Elise is the CEO of the Neuroendocrine Tumor Research Foundation. Elise will provide guidance on how to understand the needs of your community to develop an appropriate response. Thank you for being with us today, Elise.
Thank you, Will, and thank you to NORD for this invitation to participate in this webinar and share a little bit of our experience and our thought process. And thanks to everybody at NORD for the resources that you're providing to all of us as well. So if we can have the next slide, please. When it became clear that we had an unprecedented emergency with COVID-19, we started to have a lot of internal conversations about what our response should be and how and on what fronts. Our organization, first and foremost, funds net research around the globe, and we've always been a source of valid and high-quality patient education resources. So whatever we decided to do, we wanted to make sure that it was certainly true to our mission. And some of the key considerations that we were talking about in that early part of March, what do patients and families need and expect from us? They've always looked to us for net-related education, and that certainly should not change during this emergency. We also, because every organization has limited resources, and we do have a great team, but we had to be focused and very targeted. So what could we share and not duplicate? How can we collaborate with other net groups that we work with during all times and educate the community? We also knew that it was going to be important to figure out how to focus the involvement of the physicians that we work with, our board members, and other experts, because we were finding that many of these folks had been pressed into service on the front lines. Even subspecialists were being called to do things that they normally would not do, or clinics were being expanded to try and handle patient needs. So we knew that that our time with them was going to be limited, and we had to be real clear about what we were expecting and asking of them. We also wanted to make sure that we were maintaining transparency with our community, and even if we didn't have all of the answers, that we were certainly hearing their questions and trying to develop some of the content that would help them get through this emergency, not only medically, but also from a mental health and a coping standpoint. And we wanted to be really clear about our communications and not only communicate effectively, but with sensitivity. We had discussions about fundraising during this period, continuing to show our commitment to the community and answering some of the questions that patients were posing to us. We have a board of scientific advisors. That is a board that includes basic scientists as well as clinicians, and NET cancer, neuroendocrine cancer, is a very variable disease. So we really didn't see the need to provide any medical statements. There are other organizations that do that. we really saw that first and foremost we needed to be an arm for education. So if we go to the next slide to look at some of the things that we did to assess the needs, we were getting a lot of questions coming into us, and in fact all of the collaborating NET organizations were getting questions as well. So how could we source those questions and figure out what the true concerns were? We found that they fell in a lot of areas early on about did NET patients have greater risk? Well, you know, it's a variable answer. The disease presents differently. The course is different from patient to patient, and it's a very complex cancer. So there isn't an easy answer to that one. Treatment is sequenced in many different ways. It's very personalized. So we thought the best thing that we can do is source some of these questions and see if we could get some discussion around them. We also had to survey our funded researchers, and we wanted to know what was happening with the projects that we were funding around the country, and we thought that we had not only an interest in providing this information to the community, but also a responsibility to provide that information to the donors who are helping us to fund that work. And John Conti, our Director of Research, started doing that fairly early on to figure out what was happening with all of our principal investigators. We also checked out other NET organizations' activities. Like I said, there are a number of NET organizations in the space. There are very large support groups across the country that were doing some wonderful work, and in fact, we've collaborated with them. NANETS is an organization that educates physicians, and they had some educational webinars and materials online. And we wanted to make sure that we were going to share as appropriate and not duplicate, because that would take a lot of time if we were developing content that someone else had already done and frankly done very effectively. Then we decided to develop an initial plan. That came about at about mid-March. And Donna Dubuque, who is our Director of Communications, did a great job putting together a very detailed and multi-channel plan for how we would communicate to start. And our published COVID material went up starting on the 12th of March, so that we have had a platform to add to that as we have gone through the weeks to follow. We also thought that this was a time to maximize the existing channels that we had been using successfully. And early on, when we were trying to move to working fully remotely, and we had a shutdown here in Boston, so we were not in our office, plus all of us were taking care of our homes and families, we thought it was probably a good idea to use those vehicles that had been very successful and not start anything new at that particular point in time. So we brought up a landing page on our NETRF.org, which would be a home spot for all COVID-related materials, social media promotion of landing page materials and other resources through our Facebook and Twitter and Instagram, where we've been very active. We have a monthly e-update that goes out to thousands of subscribers, so we thought that is a wonderful place to have some of this material. And then we saw the need for some short email communications on some specific material. So we've done a few of those, and we'll continue to do that as information warrants. And if we look on the next slide, you can see some of our communication through our website. It may be hard to see, but on the very top, we have an orange banner that is the link to this page, and that banner also is found on our landing page. We brought this up on March 19th and wanted to call out both the mix of our original and our shared content. So you can see on the bottom some of those tiles where we developed information on reducing risk, ways in which COVID will change NET treatment, because that frankly was a lot of the concern that patients had reflected to us and the questions that we saw asked in other venues. If patients were in the middle of treatment, could they continue? If they were having treatment, were they immunocompromised? And again, that was a mixed answer. How do they deal with social distancing in treatment? What happens to their monthly injections that many of these patients are having? So we wanted to provide some of that basic information. And Donna developed a lot of that. Her resources were a lot of the CDC or WHO material, but also some of our experts as well. And then on the other side where you see some of those thumbnail photos, that is a place that we've posted a new podcast that has gone up in the last couple of days. We were also able to share a webinar that was done by an organization in Canada, which was very well done. We shared a panel discussion that NANETS had done for clinicians that had a lot of good information talking about treatment sequencing and how to look at risk versus benefit of bringing patients into the clinic, and also the use of telehealth, which fortunately is available now. And the other piece which is up there is the third one down, an interview that we did with Mark Lewis. Mark is a member of our board. He is also a patient and practicing oncologist at Intermountain Health. And we wanted to kind of get his perspective on some of the most common questions. So in terms of availability, we knew, again, he was pressed into service. He was covering the hospital more than ever. And so I made it as easy as possible, provided him the 10 questions that we had received most frequently, sent those questions to him in advance, did a recorded Zoom interview with him, and then we were able to quickly post and promote that. So I think because he was able to reflect not only the patient, but also the perspective of an oncologist, that was incredibly helpful. And then on the next slide, the continuity and some of the emails that we sent out, we felt it was important to tell our community what was happening with our funded projects, and that's the call out on the bottom. What's happened to research. We wanted to be transparent to say that some of these projects were just not continuing at this point, but we were continuing to support the researchers and the lab teams. So that message of work may be delayed, but everyone is committed to their projects. We thought that was reassuring and important to the community. So the last slide is just some of the lessons learned, I think, that we've picked up over the last couple of weeks, and hopefully will be important to some of you. Focus on what your community needs from you and can't find elsewhere. Again, target on your disease group or your disease-specific related education, because we know people can go to YouTube and find just about anything, but they need to know that they can come to your website and your materials for that validated education. Timestamp the materials. This is something that was suggested to us, and I think it was a great idea. Information changes quickly, so if you have to update something, it's good to have that timestamp. It's also okay if you don't have all the answers. Patients, I think, are getting so much thrown at them. There's so much information out there. But even if you have to say, we don't know the answer to this, but we're trying to find out, patients will know that they haven't missed anything along the way. Make it easy for your board members and experts to help you. Focus on mental as well as physical health. I think many people are doing that, and it's incredibly important. And very important, your plan should be flexible because needs will change. Things will be coming up when you don't expect it, and it's important to be able to focus your communication as you get that information for your community. So thank you for the opportunity this afternoon, and I'll turn it back to Will.
Great. Elise, thank you very much. Thank you for taking the time to present and all of these great ideas on how best to respond for our member leaders. So now we're going to have Q&A. We've collected questions throughout the call and in the registration form when people sign up to attend the webinar. We'll use the next couple minutes to answer questions that have come in, and our speakers will just be able to speak as much as they would like on any topic that gets raised. First off, before we get started with the questions, I do want to put up on the screen the NORD COVID-19 resource page, which we had a couple requests to bring back up and show to people. So for those of you out there looking at the webinar piece, you can see the URL for the COVID-19 resource page at NORD in the upper right corner of this slide, rarediseases.org/COVID-19. And that'll take you to the page that you see here, and also that Katie Kowalski in her presentation at the beginning of the webinar recounted some of the resources that you can find there, including upcoming webinars, recordings of past webinars, policy statements, so on and so forth. So I'll leave that up for a minute while we cover our first question with the speakers. So one question that came in for the speakers was, do you feel that the expansion of telemedicine for doctors is going to make it possible for patients to better access doctors in the future, who they've previously only been able to see through extensive travel, i.e. traveling to Cleveland, Duke, or Stanford? On the topic of telemedicine, what do you all foresee in the future?
This is Elise. I know we've heard from a number of the NET oncologists that this may be an enduring benefit of this crisis. There may not be many, but this will be one of them, that telehealth is more available, and most importantly, it is reimbursed now. So I think for patients who have to travel a long distance, this may not replace their consultations, their initial treatment planning, but it could be very helpful to them for follow-up visits and really reduce the stress of travel in some cases.
Yes, this is Josephine. I have to agree with Elise. For maintenance and annual follow-ups on our community, I think, telemedicine would be okay. But however, those initial visits for diagnosis do require a physical exam, and that cannot be replaced by the telemedicine.
Yeah, this is Katie.
We have Go
ahead.
No, go ahead, Katie.
Oh, no, I was just going to, weigh in and basically agree. I think that COVID-19 is going to be transformative for telemedicine. And then in the post-COVID world, it's going to be, more broadly accepted. Just before COVID hit in early March, NORD promoted the telemedicine program at the Rare Disease Institute at Children's National. And I had the pleasure of meeting the Dr. Natasha Schur, who created that program. And in our conversation, she said there are visits that I absolutely need to be, hands-on and in a clinic with a patient. And there's other visits that are extremely productive. We cover tons of territory, and it's done, in a way that's much more comfortable for the patient and the family from home via telemedicine. And, the insurance issue has been huge during COVID, and now there is much more, broad coverage. So I think more payers are going to understand in the post-COVID world the broader applicability of telemedicine and the importance of caring for patients who can't, for whatever reason, get to a clinic. And then lastly, for the rare disease patients, it'll be particularly beneficial because they often live far away from the specialists, who they need to treat their condition, just as the, person who wrote in and asked this question shared.
Yeah, I echo all the great points that everybody's made. I'll add into it, think about which I've been thinking about, all the rare disease families that have the access issues with travel, with wheelchairs and oxygen tanks, all those kinds of things that now this is an opportunity to make access so much easier, quicker, and whatnot. And I'm also very interested to see how AI plays a role in this. I mean, in the blind community, we still have to have certain retina scans and retinograms and stuff like that, but there has been a lot of developments in AI that could possibly be a nice collaboration to help with all this. So it'll be very interesting to see how it goes moving forward.
Yeah, this is Josephine again. And I think one of the important things is that this has relaxed some of the licensing issues for a lot of physicians. So now they are getting the ability to provide telehealth to people that are outside of their state, and they have to be licensed for that. And I think that's a great win for a rare disease community where, they weren't able to interact with a physician because he's not licensed in their state via telemedicine, and now maybe they will be. And so I think that's a great win for the community.
Okay, great. Thank you for all of you for your input. Another question that came in during the course of the presentation was around reaching new medical advisors. If all of my medical advisors are unavailable as they are on the front lines addressing COVID-19, how would you recommend reaching out to new medical experts? I know Kristen and Katie, you all sort of touched on this topic a little bit during your presentations.
Yeah, I mean, we have an issue with several of our folks that are at Columbia, and Columbia got shut down, and it's kind of been a mess. But we also have, it's important to have a diverse, and we all know it's important to have a diverse medical advisory board, and this is one of those key components of why that has helped us. Our very first thing that I talked about with our Zoom call was a genetics counselor, and that's actually who can give so much information to our community that they need for so many of the questions that they have. But yeah, definitely keep it diverse. And if you don't have we didn't have a diverse community. So don't let me sit here and act like, oh, we had this great scientific advisory board. We didn't. We just diversified and expanded it at the beginning of 2020. So thank God we did that. We're able to call on them while other ones are on the front lines, because then you don't know what's going to happen. The next sucker punch could call half of your committee in other positions to address something. So bottom line is it's important to have a diverse board.
Well, this is Katie. I can just, briefly add, it's just a time to mobilize and be creative with your networks. We were fortunate to have an education committee in place, but then, NORD has annual events that we hold where we feature, speakers with all kinds of expertise across the space. We keep lists of those so that we can leverage those. We can call our different partners who we work with throughout the year. I call even my colleagues internally in different departments. Membership, your department is such a great resource. NORD has, well over 300 member organizations now. And within those organizations, there's, amazing expertise. We have also lists of reviewers for our rare disease database and our continuing medical education program. So it's really just leveraging it all, thinking where you can find people and not being afraid to reach out and ask for help.
This is Elise.
The
only thing I would add is,
Elise, go ahead.
we were sensitive when we thought about who can we talk to, who can we ask to participate in anything from a podcast, because Laren Hyder does our podcast series, and the enduring content on the website that Donna's been working on. We really looked nationally because we knew if we had to try to ask someone for time and they were in New York or they were in California and some of the places that were surging at that point, we probably would not be very successful. So we looked nationally. And again, I mentioned the recorded interview that I did with Dr. Lewis. Just so happened at the point that we were doing that cases in Utah had not spiked. So, I think for those of you who are national, that's something to kind of think about too if you're trying to ask someone for time and involvement, to, really look at where are they and what's happening in their world at that particular moment.
Okay, great. Thank you for the feedback on that topic. Now I've got two questions that are in the nuts and bolts of online platforms and communicating with your rare disease communities. The first is, have you done or considered webinars or Facebook Live events after hours, in other words, outside of normal working hours during the day, in order to accommodate physician or medical expert schedules? That's something that any of you who have done webinars or live events have considered?
So this is Josephine. We've been running webinars in the evening for the last 2 years. So we do them monthly on a different topic, and we run them at around 7 o'clock so that hopefully it's not too late in the evening and people from the East Coast and the West Coast can participate.
Mm-hmm.
Yeah, this is Kristen. We did the same thing. I think our I don't know if we've ever hosted anything before 8 o'clock at night here on the East Coast.
Okay, great. And then another question about conducting these live events or webinar events. Do you have a sense of what percentage of engagement you're getting from your rare disease community? Do you have any sense in terms of numbers, what percentage of people you're inviting versus the number of people that are participating in these? And then further, do you have a sense of how many people are coming and listening to recorded webinars after the fact?
So this is Katie.
Josephine.
Oh, go ahead, Josephine.
Okay, so for the COVID webinar was the highest participation we had. We actually had to up our subscription. We got over 1,000 people listening into that first webinar. For our regular webinars that we do on a monthly basis, they run between 100 and 200. Obviously, we have a much larger database that gets this information. But we don't see all of that participation in the webinars.
Okay, thank you, Josephine. Katie, did you have something to add there?
Yeah, no, I was just going to add, well, similarly to what Josephine just said, our COVID webinar, we had a larger number than usual. We had over 2,300 registrants and over 1,100 for the live event. But I do know that our average is around 740 registrants for our webinars, and usually we get anywhere from 1/3 to 1/2 tuning in live. I am not as sure about how many people, and I'm actually going to go look at it now, visit the recorded versions. We make them available on NORD's website, and we put them on YouTube, and we get tons of requests from people asking us to send the links. So I think those are pretty well visited as well. Thank you.
Okay, great. Anything else on the platforms? Any suggestions on the best platform to use for live events? I know, Kristen, you said that you were familiar with Zoom, hopped on it pretty early in this, and of course now its popularity has really increased. You've had good experiences with Zoom. Any other platforms that folks recommend?
I would say that if this
Okay,
is Kristen, you
yeah.
just have to consider the ease of use for your community, because as we were looking into some platforms before, some of them do a heck of a lot more than Zoom and have really cool features and stuff, and you can collect a lot of information and exchange. However, you just got to balance that versus, is it going to be too frustrating for families? And you guys know some of your families, the stuff that they're already dealing with, and then at the end of the day, just trying to get information from you, how easy is it to just click in there and hop on? So it is a balance of stuff like that. And some, we're looking at different webinar platforms that we can have a little more bells and whistles and plan in advance, as opposed to just being able to have families hop on. So balance is key there.
Okay, any other thoughts on platforms? If not, we're coming up on the top of the hour, and so we do want to wrap up and respect everybody's time. So if you have a question that didn't get answered on the webinar, or if you have additional questions, just as a reminder, please email them to nord@membership@rarediseases.org. We will be sharing a link to this webinar recording in our future e-newsletters. And in closing, I'd like to thank Katie, Kristen, Josephine, and Elise for being on the line with us today and for sharing their best practices and supporting their communities. Thank you also to everyone on the webinar for joining us. Don't forget to provide us with your feedback on today's call in the closeout survey, and please feel free to suggest future topics for us to discuss and explore. One note of information just for folks out there who would like to know the status of NORD. At NORD, we made the decision to have our entire staff across all 3 offices in Connecticut, Massachusetts, and Washington, D.C., including our busy call center in Connecticut, work remotely for the foreseeable future. So we are encouraging social distancing. We're practicing social distancing. Definitely the right thing to do to help slow down the spread of COVID-19. But be sure to know that as we find ourselves working from home, we're still continuing to support the rare disease community. We'll be here for all of you. And we ask you to remember that alone we are rare, but together we are strong. So thank you very much for joining us. Thanks to all our speakers, and goodbye, everybody.
Thank you. Bye.
Bye-bye. Thanks, Will.
Thank you. Thanks.
Everyone.
Thank you.